Good morning and welcome, everyone. I want to thank the organizers for this event. It's truly an amazing time to be thinking about having a family and being a gay man. I'm the medical director at RMA of Connecticut. We have 4 offices in Connecticut. Our office in Stamford and Norwalk are close to you guys. Our IVF center is actually in Norwalk. We do about 700 egg retrievals a year. We have a separate team for third-party reproduction, which is the team you guys would be on. And what I like to do, because it is a hard process to get through, is we do have some free Skype consultations at night, because I know everybody's working. So I regularly do those between 6 and 9 p.m., and we can coordinate those. The other thing is as a gay man who's kind of worked through these steps, we've also built out a separate website that is called Gay Parents to Be, and it's a little bit more medical and focuses on kind of some of the steps that you have to think about going through the process. And it has a wonderful blog and a wonderful Facebook. There's over 3,000 likes at this point. I'd encourage you to use that as you gather information. And I'm honored to be a speaker here today, so I'll stop talking now because you'll hear more from me. Thanks. Good morning again. I just have some slides here, which I think are up. Let's see if I can make this go away. And so the reason why we're here today is self-education, choosing an IVF center. In vitro fertilization is part and parcel with the process that everybody needs to go through to build a family. And choosing an agency is a really important process to protect your rights and the rights for you to bring your child home. As far as the building blocks of this process, basically we need sperm, we need eggs, we need either a fallopian tube, which is what happens in the natural process, or an IVF laboratory. So basically, embryos spend 5 days in the fallopian tube, or they spend 5 to 6 days in the IVF laboratory. And that's really the role of the IVF laboratory, to nurture a 1-cell embryo to an 8-cell embryo to a 250-cell embryo. And we all did that. We all were embryos once, which is an interesting concept. Once you have an embryo, then they're going to go into a healthy uterus, and Dr. Danishmand's going to talk about that. So I'm going to talk about the sperm and the egg here. As far as egg donors, there's always a big question. How do you find egg donors? Well, egg donors are found either by advertisements on the web or regular published advertising. And egg donors are asked to fill out a questionnaire. Sometimes it's a short questionnaire. In our office, it's a 15-page questionnaire. And these questionnaires come in fast and furious. And the reality is 90% of them are rejected. They're rejected for many reasons. Maybe somebody has irregular menstrual cycles or has other gynecologic problems. Maybe they're too old. Most clinics have an age cutoff. Maybe they're too young. Most clinics won't use people less than age 21. Maybe they actually lived in Europe for more than 6 months, and our government has decided that because of the risk of mad cow disease, you can't use an egg donor who's lived in Europe for more than 6 months. The other things that rule people are their own medical conditions and their family history. And there's always a question, well, how do you know they tell the truth on that? And you actually don't know. But for the 90% of people who got ruled out, it doesn't matter. They're out. So the 10% of people that get invited in our office, it's about a 4-hour appointment day. They go through medical screening, psychological screening, and nursing education. The medical screening involves a medical interview with myself or one of the other board-certified doctors in my office, and it focuses on, do they know what they're getting into? Informed consent. We discuss with them, do you really understand that you're going to go through 10 days of fertility medicines, you might gain 5 to 10 pounds, there's a risk of bleeding infection, there's a risk to your own fertility, and kind of say, if you're really just doing this because you know about the reimbursement, it might not be the best idea. We also ask all the egg donors, why are you doing this? You get 3 answers. They're all actually nice answers. I'm not using my eggs and I want to help somebody else have a family. I have children, and I want to help other people have a family. And I've made some decisions in the past, and this is a way that I can kind of balance the scales. And they're actually really passionate about this. By the time they've gotten to this step, they've completed so many steps and done so much homework, they're usually ready to go. But they're not ready to go till they do infectious disease testing, hepatitis, HIV, syphilis, and some other special FDA-required infectious disease testing, as well as we do check their genetics. So you want to know if your egg donor has a recessive disease like cystic fibrosis or thalassemia or sickle cell disease. Those things are all done up front in the medical visit. Hormonal assessment to check their ovarian reserve. Not every 25-year-old egg donor is a good egg donor. Once we get done looking at 2 hormones called follicle-stimulating hormone, anti-Müllerian hormone, and their ovaries. The ovaries basically are the testes in the body, right? Well, ovaries are a little bit different than testes because women made all their eggs when they were 5 months in their mother's uterus, and you can actually get a baseline kind of picture of how many eggs a woman has at the start of a cycle called a basal antral follicle count. And it's a powerful tool to assess whether someone would be a good egg donor. Urine drug and toxicology screening is done on that same day. So I actually ask all of them, have you been to the dentist? Have you been to the doctor? Have you taken anything? Because it's going to show up. As far as the next side here, the psychological assessment, that's really essential. We have 2 mental health care providers that screen our egg donors. They are asking the egg donors, do they know what they're getting into? How did they come to this decision? What other support structures do you have in place? They assess them for mental illness, also their emotional stability, whether they have a partner or not, and they're aware of it. They talk to them about the fact that there could be a child 20 years from now who actually wants to know more about their family history because there's known and anonymous donors. They also give the donors a psychological test. It's called an MMPI or a PAI-1, and it's basically the same 10 questions, 30 different ways. It's a test for mental illness, depression, reliability, and that's the psychological screening part of this. Then the nurse walks in and says, you understand you're going to do shots. You have to return my phone calls. You're going to have multiple transvaginal ultrasounds. You're going to have a blood draw every time you come in. And if you don't follow these rules, you're not going to play through. And then they give them a hug and play the nice nurse as well. The nurses are really the lifeline to keep the donors in the program. In fact, many donors in our program donate the maximum recommended by the American Society of Reproductive Medicine 6 times because they actually like the process and they like the contact with the office. They get taught to give injections, and then basically we all talk, and that either leads to acceptance or rejection. Somewhere around 50 to 70% of the 10% get accepted. So out of 100 people, we might get 5 to 7 donors that get accepted for different reasons. As far as the intended fathers, you guys, there's medical interview and testing on you. There's also psychoeducational counseling. Nobody's screening you to be parents. I tell everybody when I meet with intended parents that they should let it all hang out, ask any question they want, and talk about their future together. This is very important. It's your time to basically work out some of the things that you might not have ever talked about with your partner. And identify and work with the agency. Some people try to do this without an agency. I really think that's a challenge, and there's lots of great agencies here, and you should make those connections here. As far as medical interview and testing, overall health assessment, go to the doctor, get your blood pressure checked, check your health. You need to be around for these kids for 25 years for their mental health so they can grow up. Medication review. If you're taking testosterone, you can't take testosterone. If you have a history of anabolic steroid use, if you're taking Propecia, some people are concerned about that. There's some high blood pressure medications you're not supposed to take. Infectious disease testing, same idea, hepatitis, HIV, syphilis. You're going to need a semen analysis. What is your sperm count? Sperm count assesses concentration, motility, and the percentage normal forms. It's usually 3 to 5 days of abstinence. 2 to 5 days of abstinence in between. It's a 3-month snapshot. You can actually make your semen analysis better with some things that you can change in your lifestyle. As far as we live in an age where hepatitis and HIV positive men can be intended fathers with special sperm screening and clearing. This slide is complicated. In the interest of time, I'm going to skip it. But basically, these are all the things you need to consider as you pick out your egg donor. You can see there's everything in here from level of anonymity to whether she's donated before. This is the process. Basically, sperm mates egg, we make embryos, and then we have a day 5 embryo here that's transferred into the uterus and potentially assessed. At my practice, at many practices, we only do day 5 transfers because they're associated with the highest pregnancy rates. And they allow you to decide with a better kind of clinical judgment of whether you're going to transfer 1 or 2 embryos. And it's a big decision. Twins sound great, but twins have about a 4 to 10 times higher risk of complications. And twins, even if they're healthy, represent a lot more work on the other side, and they can be more complicated from an insurance point of view. As far as genetic testing is available now, so you can know whether your child has, the embryo is at risk for Down syndrome or a high risk for pregnancy loss. As far as for me, what made me passionate about this is how I've built my family. So I'm a gay man. I've also gone through 2 surrogacy journeys, and it's been a journey. So this is my family. This is my child, and I can speak to this directly, and it's actually been amazing, and it's really humbling to talk to you guys and encourage you to think about it because it is a dramatic change in your life for the better. Based on this passion, we built out Gay Parents to Be to try to help people collect some of the medical information on the other side of the social and information on this, and thank you very much for your attention.
Thank you.